What's been your experience with pulse irrigation for complex wounds?
So I'll say I grew up in a physical therapy-based wound care clinic, and so our PTs were knowledgeable of pulse lavage and pulse irrigation, and I'll still see it in the operating room. I'll say I am a fan of it one time. So I typically advocate for a pulse lavage to really clean it out. The problem with pulse lavage is that there's really high PSI, and it causes a lot of tissue swelling and edema, and you don't always want that. I can remember a case I had where this 7-year-old lady had hand wounds or had a hand infection, and they debrided it and made multiple incisions and then were pulse lavaging it afterwards. And her hand became so swollen that it was like the cytokines couldn't get to the wound base in order to heal it, and she just continued with edema and then had some circulatory compromise. So once we stopped using pulse lavage and actually put on a therapy to decrease her edema, she healed rapidly. And so I think it can be great, or it could be harmful. So you just have to take a look at your patient factors. The other thing that I'll say is that from a labor perspective, if you're doing it at the bedside, there's obviously an infection concern with pulse lavage, and it does take a lot of setup, personal protective equipment, making sure the room is set up so that we're not spreading or aerosolizing bacteria is pretty important. So in my experience, we don't utilize it outside of the operating room.